And the way that we structured this session is really the way that quality rating and improvement systems are structured. So we have two components. The first is on the rating component, which is how states assess quality in the state, across the state. And the second is the improvement component, which really more closely aligns to the conversations we were having yesterday, or more proximally aligns to that. And so more specifically, the first presentation is by Sandy Hong and myself. We'll be looking at sort of the most basic level of quality rating and improvement systems, the rating component, and looking at whether that relates to children's learning. The second presentation focuses more on one specific QRIS in Miami-Dade and the quality improvement efforts that are going on there. The third paper is by Catherine Tout, and it sort of pulls back and looks at across the country what's going on in terms of quality improvement and implementation, in terms of the evidence and practice. Then we switch to our panel, which pulls back even farther and talks about quality improvement systems as well as other national quality improvement efforts across the country. And then lastly, Marcy Whitebook is going to give us a brief conversation about adult learning, potentially thinking about the alignment to quality rating and improvement systems and professional development. And so as you're watching all of these sessions, sort of the main thought that we're having in our heads as we're watching these sessions is the extent to which professional development could be linked with ratings and quality rating and improvement systems. Should they actually be aligned, or should they be thought of as separate things? Should they be kind of thought of as separate systems? All right, so the first presentation, we are looking at whether quality ratings in pre-kindergarten programs relate to children's learning. And we'd like to acknowledge our co-authors, Peg Birchinall and Bob Pianta. And so since we're the first session, I thought and it's early in the morning, I thought I would just give a brief talk about what quality rating and improvement systems are, and then we'll get to our findings. So we know that they're a popular policy tool intended to improve school readiness, and the first QRIS started about 15 years ago. And I think it's not even over half, it's probably like 3/4 of the states at this point have QRIS. And this is in large part due to the rapid proliferation due to Race to the Top, the Early Learning Challenge. And this overly simplistic model of quality rating and improvement system basically says that states go in when they're designing a quality rating and improvement system, and they select certain quality indicators. So these might be staff qualifications, teacher-child ratio, or observational measures of quality. They then take each of those individual quality ratings, measures, and convert them into something like a point system or a rating system. States then aggregate those multiple indicators of quality together to form star ratings. And there's sort of two hypotheses about what the effect of those ratings are. The first is this market-based approach, which is that local consumers of quality are going to start choosing different centers based on those ratings, which is going to cause programs to change or increase their levels of quality, which would ultimately lead to child well-being. The second hypothesis is that having those ratings could be a really good place to help programs improve their quality, and so you could attach improvement supports and incentives to that actual quality, which then would lead to improved child well-being. And the development of these things has been a combination of states both applying empirical research to how to select the indicators, as well as sort of the professional judgment in terms of how to aggregate these ratings and convert them into star ratings. And so the main goal, there are lots of different goals of quality rating and improvement systems, but potentially the main goal of QRIS is to improve school readiness, although admittedly there are other things you might be interested in, such as professionalizing the teacher workforce. But states really aren't selecting quality indicators that we know potentially are related to child outcomes. The second thing is that as states are seeking to provide consumer-friendly labels of quality, such as these star ratings, we know that these might not represent meaningful differences in quality because there really is an absence of literature in terms of the thresholds and the points in which states should cut these things off and convert them into ratings. And lastly, as states are trying to seek to apply developmental research to policy, we're not quite sure what these ratings are going to do because there isn't enough literature about when you mush them all together, things that might matter and things that might not matter, and convert them in a relatively complex way, whether those would relate. So our paper really kind of tests the core assumption of QRIS, which looks at first both do the individual measures that are selected for quality rating and improvement systems relate to improve child well-being, as well as whether the aggregate output of these ratings, which is star ratings, relate to improved child well-being. So to do so, we look at the range of quality indicators and metrics that are used to determine levels and establish QRIS across the country, and we look at whether quality indicators and aggregate ratings relate to child outcomes. And we do so by simulating or replicating 9 established QRIS across 9 states in the country, and I'll get into how we selected those states. as well as a generic approach that simplifies the ways that states are structuring their QRIS and also includes an indicator, which I'll discuss more. Okay, so quickly, I'll go through how we selected these indicators. We relied on Catherine Tout et al.'s compendium of QRIS, and we basically said that there were certain qualifications that you had to have in order for us to simulate or replicate your QRIS. So the first is that these quality rating and improvement systems had to serve pre-kindergarten programs because the data set that we're using is only a data set of pre-kindergarten programs. The second is that we wanted QRIS that were somewhat vetted in the system so they weren't constantly changing the ways that they were structuring their indicators. And so the QRIS had to be established before 2009. And the third is that the state had to have 4 indicators that we could replicate in our data set that were relatively popular. So for instance, all 26 states at the time had some staff qualifications. We were able to replicate that in our data set, and so we selected states that had staff qualifications in their indicators. The same goes for environment, which is basically the ECRs. We could replicate family partnership is relatively complicated, but we could somewhat replicate that, and step ratio and group size. The ones in the middle we just couldn't replicate in our data set. They're not important. It's not that they're not important, we just couldn't replicate them. But basically we have 4 that we feel like sort of shows the different types of ways that states are replicating or selecting indicators. So our main question, we have 3. The first is whether individual quality measures relate to child outcomes, so things like staff qualifications and teacher-child ratio. The second is whether individual quality indicator levels, so once those continuous measures of quality are converted into points or levels, whether those relate to child outcomes. And the third is whether aggregate ratings relate to child outcomes. So we use the NCDL sweep data set, which was really ideal because it has 11 states in their QRIS, in the data set that we were able to replicate QRIS across all 11 states. So for instance, if one state had a certain cut point for teacher qualifications, we replicated that across the entire data set. And it actually kind of worked to our benefit because now with sort of the increased emphasis on pre-kindergarten programs, I think people are increasingly interested about how to assess quality in pre-K. So we end up with about 2,500 children in 673 programs in 11 states. Our outcomes are the normal academic, language, and social emotional outcomes. And we selected 5 indicators of quality, which I discussed earlier. So for staff qualifications, we used the data set that we had, which selected information on teachers' level of education, years of experience, early childhood major, as well as the same thing for directors. So what this means is that if states had other things in their staff qualifications, such as training hours or professional development that's wrapped up in their QRIS rating system, we were not able to replicate this. So in some sense, this is the most kind of pared down way that we could think about staff qualifications. The second was environment, the ECRs. And so what we were able to do is if state B had a 5.5 as their cut point for the highest rating, we could look at whether that was potentially more effective in predicting outcomes compared to state B that had a 5 for their highest ratings, or state C that had a 6 to determine their highest rating. So it allowed us to look at, all right, what states are doing and whether that is differentially predicting outcomes. Third was family partnership, which was really complicated if you've ever dived into into how QRIS are structuring their family partnership. It is complicated and relatively hard to pinpoint and replicate. So we just made 7 domains of categories of things that are included in family partnerships. And then if, let's say, state A included 1, 2, and 3, then we would include those. Ratio and group size was based on teacher report. And then because none of our states that we selected included the class, but we were interested in sort of the utility of including the class, we created a generic system which simplified the point structure and the ways that states are rating, sort of configuring the rating system. And so we created a generic system that included the first 4 indicators as well as the class. So just to walk you through this quickly, in the generic approach, but we did the same thing for every state. We took the continuous measure of ECRs, let's say, as an example, and we looked at whether that related to outcomes. We then converted that to points based on very clear cut points. So let's say a 2 and below was a 1-star, and 5 and below was a 4-star, and converted those to points and checked whether that was related to outcomes. Then in a point system, we added together all of the indicators together to create a sum score. And this is exactly what states do, so this is how we structured the point system, but it's the same for the building block or hybrid approach. And then based on cut points, we converted those to levels, which is what is typically disseminated to the public. And I will let Sandy give you the results.
Sorry about that, my pregnant belly is getting in the way. So we used a 3-level HLM model. It's a value-added model, and we had lots of child and family and program-level covariates, state-level covariates in our models. We're going to organize the results according to the organization that Terri just mentioned. So we'll look at individual quality measures, individual indicator levels, and then the aggregate ratings and how they predict a child outcomes. So first we have the individual quality measures, which are the continuous measures we typically see presented in developmental research. And as we expected, the standardized effect sizes of each of the quality measures on all of the child outcomes, at least some of them reached statistical significance. But they do have small predictability for at least one child outcome for each. Another way to look at this is in a figure. And you can see that for the continuous measures for math reading measured by the Woodcock-Johnson rhyming subscale and receptive language, that only the Eckers in the class were significant predictors of children's learning with small to moderate effect sizes. So next, and I'm kind of running through this, but we can go into more detail with questions later if you have them. So looking at the individual quality indicators where now they're broken into scales and then combined together with other measures, they did still predict child outcomes after breaking them up and combining them. And on this side, we present the standardized effect sizes of the generic QRIS by quality indicator, comparing the highest and lowest categories for each quality indicator. The high to low contrast quality for teacher-child interactions had the strongest association to children's skills, and the environmental rating scale predicted children's language skills with smaller effect sizes compared to the teacher-child interaction quality. But none of the contrasts for staff qualifications, ratio and group size, or family partnership indicator were reliably different from 0. Most of the states do use cut points that were predictive of some child outcomes, and using various composite scoring methods all yielded positive results for child outcomes, although even at the highest levels, the effect sizes were small to moderate. And now we'll transition to the key score of quality rating and improvement systems, which is the overall aggregate rating provided to parents and policymakers. So the key question is, does the overall score predict child outcomes? And the answer is that the results were mixed. In the generic system, composite ratings were significant predictors of far fewer child outcomes than the 5 original single indicators in the continuous form, or when they were categorized into individual quality levels, including the child outcomes shown here. In addition, there were few associations in the 9 replicated established QRISs to children's learning. And notably on this slide, the states with the most simplified systems, which were State A and State D presented on this slide, were the only rating systems that predicted children's development in pre-reading skills. So across states, using either the building block or the hybrid methods resulted in fewer associations between quality rating levels and child outcomes than the points-based method. So in conclusion, the rapid proliferation of QRIS across the U.S., an expensive proposition in itself, calls for an increased need to better understand the key output of these systems, the program ratings, and associations to school readiness outcomes that are intended to forecast and improve. For QRIS to have the intended benefit of improving quality and child outcomes, programs that receive the highest star ratings should improve children's skills more than programs that receive the lowest ratings. And our findings indicate that although individual observational measures of quality, and particularly teacher-child interactions, were often predictive of children's development, once multiple indicators were aggregated together and converted to ratings, pre-kindergarten program ratings failed to yield consistent and meaningful relations to children's school readiness. I'm going to try to catch my breath. This pregnancy has taken away my breath a little bit more than usual. So, thinking about what the takeaway points from this study, states might simplify their quality rating systems and their measures by targeting measures that have strong empirical evidence to make a difference for children's development, and take care in combining measures into indicators that may relate differently to children's learning. And additionally, given the costs associated with collecting multiple measures, this evidence might act as a guide to direct efforts to trim quality ratings while enhancing the validity of those ratings. Additionally, there are different methods for scoring QRIS, and using a points-based method may provide more variability in outcomes, which allows states to be able to predict better child outcomes than a building block system. And potentially including teacher-child interactions as a focus of the quality review might be important. And finally, considering that overall scores should predict better to child outcomes. Higher scores should predict better to child outcomes than lower scores. So some implications in extending this work. These findings also have implications for the K-12 accountability efforts, including public school report card systems that seek to convert measures of quality to easy to interpret letter grades. It's another example of this type of scoring configuration. And our findings indicate that complex algorithms that convert multiple assessments of classroom and school performance that are only distally related to children's development may make ratings translate easily to the public, but is obscure possibly important effects of key quality indicators. So as QRIS become more commonplace, it's increasingly important that ratings link to children's learning to ensure that states incentivize and improve the aspects of quality that matter most for the nation's children.